Thanks for coming in tonight, everybody. I'm Dr. Jason Myers. I'm the Medical Director of Family Medicine out in Zeeland at our Lakeshore Health Partners Zeeland office. I'm going to talk to you, get a general overview today about men's health and what kind of things from a family practice perspective, a primary care perspective, and then you're going to get some specialists talking to you about more honed down kind of things. This is a kind of a quote that I saw that kind of details a little bit about what we're talking about. Know your enemy and know yourself, and you can fight 100 battles without disaster. Chinese generals from 500 BC said this. We're going to talk about the top 10 diseases that kind of kill men, and that's kind of the enemy that we're going to talk about. These are the things that we're going to be trying to prevent and the things that everybody needs to know about in order to know how to prevent them and to stop them. The number one killer of men by far is heart disease. That includes things like heart attacks and strokes, ventricular fibrillation or heart arrhythmias. So that's the thing that's going to take out most men, and so it's one of the number one things we need to talk about. We have Dr. John Greibar here today who's going to come in and talk after me, and he's going to spend a little more time talking about this. So if you want to pay attention to number one, pay attention to his lecture. He's going to be the one that's going to save the most lives for us here. Number two is cancers, and the number one cancer out there for men is lung cancer, and most of that's because of smoking. So the second most common cancer is going to be colon cancer. Then you have things like prostate cancer, skin cancer, and things like that follow up on that. Then this third one isn't really a disease, but it's the third leading killer of men, and it's accidents. So car accidents, falls, work accidents, extreme sport accidents. Anything that would be outside of that is the number three killer of men. So there is some things you can be careful of there. It's not actually a disease we can prevent, but it is certainly something to think about. And then stroke is number 4. COPD is number 5. Again, another smoking-related illness for the most part. Number 6 is diabetes. And then we have influenza and pneumonia, so basically some infections bringing in at number 7. Number 8 is suicide, so men killing themselves, which would be depression and mood disorders and maybe anxiety and stuff like that. So some things we need to work on there. And then kidney disease, and then Alzheimer's disease is number 10. In men aged 41 to 50, a shocking 55% of all deaths in men in that age group are from heart attacks, strokes, and heart disease. So by preventing that in that one group, we can prevent over half of the deaths in that age group by just doing good cardiac care and good cardiac prevention, which is pretty significant if you think about it. That's a fairly young age group too. So main preventable health issues that lead to death, as I said on there, several of those things are smoking related. So if you're a smoker, you're going to be at increased risk for heart attacks, strokes, coronary artery disease, vascular disease, COPD, emphysema. You're also going to be more likely to get things like pneumonia, influenza. Those kind of things are going to be more problematic in a smoker. So if you're a smoker, the number one thing you can do to improve your health is to stop smoking. And as physicians and providers, one of the number one things we can try to help our patients do is quit smoking. High blood pressure is number 2, and high cholesterol, they kind of go together a little bit. Those two things are kind of another 1-2 punch for coronary artery disease and vascular disease. So controlling your blood pressure helps prevent strokes, heart disease, and then also controlling your cholesterol helps prevent the blockage that happens in the coronary arteries that leads to heart attacks, and also in the vessels of the neck and legs that lead to strokes and peripheral vascular disease and things like that. Obesity is another preventable major health issue that leads to death. Obviously, we always preach a lot about health, fitness, and weight loss and try to keep your weight down towards your ideal weight. So one thing that as a patient, anybody can work on is keeping their weight down. And then mood disorders, depression, anxiety, and stress. Preventing those kind of things will prevent that number 8 cause of death, which is suicide. So if we can keep guys happier, maybe they won't kill themselves as much, and maybe not each other also, but definitely not each other themselves. And then this one, become a road safety warrior. Men sometimes think we're better drivers than women, but we're really not. Third leading cause of death is car and bike accidents. And when I say bike accidents, a lot of like motorcycle accidents, also bike riding accidents. So we really aren't very good drivers. And so alcohol is also a major player in this cause of death. So those two don't mix, and they add up to one of the third leading causes of death in men. So don't let your husband drink and drive, or your kids or your son or anybody. So prevention, routine physicals. There is some debate about whether routine physicals are really necessary and whether they're really a help in reducing death and heart attack and picking up disease. Most of your major medical organizations don't really support annual physicals. Even major insurances like Medicare won't even pay for an annual physical. So the data isn't there to always support annual routine screening from a physical standpoint of a healthy population. However, there are certain things that are very important to get checked relatively often, and that would be like cholesterol and blood pressure checks. Those are the kind of things, if you pick those up early, get on the right medications, do the right lifestyle changes, can help prevent heart attack and stroke, again, one of the number one causes of death. And then cancer screening is looking at lung, colon, prostate, and skin cancer, keeping up on immunizations, smoking cessation, depression screening, and regular exercise and maintaining health. We still do a lot of physicals as primary care and family practice. We try to get everybody in for an annual physical, and most of the reason we do that is it gets people in the routine of coming in frequently. If we just tell our guys in particular, well, come in every 3 to 5 years and we'll check some things, we'll never see them. They won't come in. They'll get lost in the shuffle somewhere and it won't come around. So by kind of instilling this annual physical kind of thing in, at least we're ensuring that they get in and see us and we can pick some of these things up and try to do some prevention. Yeah.
Or prescriptions that you're on an ongoing annual, biannual basis, don't I have to come to see you to get it reauthorized for the next year?
What he asked was for routine prescriptions. If you're on them, don't you have to come in for an annual visit, or at least regularly? And yes, you would. I'm not saying that for certain things you would still come in for routine visits. You'd still come in and get your blood pressure checked, your height checked, and your weight checked, and you'd still go through some of these other preventative things. But that doesn't necessarily have to be in an annual physical. You can come in and do those things at just a routine visit, or a routine office visit, or just a routine stay. So you don't have to have an annual physical to get those things done. If you had hypertension, if you have like hypertension and high cholesterol and things like that, certainly you're going to be coming in more often for those things. And the more health problems you kind of have, the more visits you're probably going to have to see the doctor. So,
what immunizations are you talking about later on in life?
Flu shots are a big one because remember, influenza was a big cause of death. And then the pneumonia shot is also another important one after age 60 or 65. Depending on what your health problems are, is another big immunization. Hepatitis A, hepatitis B, some of those things you can get later in life. But the big ones are going to be influenza and pneumonia. So those are two big killers. They were in the top 10. So by immunizing yourself against those, you can help prevent those diseases and prevent death. Regular exercise and maintaining healthy weight. Dr. Erickson Adams is going to talk a little bit later about some of that too, so we'll get some of that back into that too. So just in a general sense, if you're in the 18 to 39-year-old category, this is kind of the minimum sort of screening stuff you should be having done. Certainly I'm not telling you not to go get your annual physicals and done and stuff like this, but this is at least the minimum kind of stuff that you're going to want to do. A dental exam once a year, every 2 to 3 years, blood pressure, height, weight measurements, and a brief physical, and every 5 years getting your cholesterol checked. That's the minimum recommendations by the United States Preventative Task Force, the AMA and the AOA, kind of the minimum kind of things that you're going to want to do for health prevention. If you're in the 40 to 65-year-old category, every year getting a physical exam for cancers like skin cancer, thyroid cancer, checking lymph nodes, prostate, and rectal cancer. Again, a dental exam. Every 1 to 2 years getting height and weight measurements, blood pressure check, stool sample check for blood, and a vision and glaucoma check. And every 3 to 5 years checking cholesterol, sugar, Sigmoidoscopy after age 50 for colon cancer. Most of the time we're doing colonoscopies now, not sigmoidoscopies. Not too many people get a sigmoidoscopy anymore. They do the full colon for the most part for that. That starts at age 50. Depending on what you find in that colonoscopy, you'll either come back every 3 to 5 years for one of those or every 10 years if you didn't find any polyps or anything like that. So again, minimum kind of requirements for what you'd want to do. Many people are going for annual physicals and having some of this stuff done more on an annual basis, particularly blood work and that kind of stuff. Men over the age of 65, height and weight measurements, blood pressure checks, physical exam for cancers, stool sample, and a dental exam every year. They have a few more things they got to get done. 1 to 3 years, a hearing check, vision and glaucoma check, lab tests including thyroid, blood count, cholesterol, sugar, and urine samples, and every 3 to 5 years, sigmoidoscopy for colon cancer. Again, we're doing mainly colonoscopies, and they're going to be every 8 to 10 years if it's normal, and only 3 to 5 years if you have polyps. Questions? Well, I don't sell hearing aids, so no. It's just so your wife can hear you, or when she's talking, you can hear her, and you can't blame it on somebody else. No, hearing is obviously very important. It's one of your 5 senses. You can drive better. You can live a better life if you can hear well. And so that making sure that you can hear well is a very important one of your things that you want to keep track of. So not to really sell you hearing aids. Unfortunately, if you have bad hearing aids are one of the only ways to fix that. And so it is what it is. Yeah, if you have bad hearing and want to improve it, you got to buy hearing aids, which are kind of expensive, but they're getting better and they're getting a little cheaper as they're getting more competitive. So go ahead. Every study that's been done on cholesterol and the lowering of cholesterol has shown that when you lower your cholesterol, it reduces your risk for heart attack and stroke. It doesn't matter even where your cholesterol starts out as. If it starts out at 300 and you bring it down to 250, you lower your risk. You start at 250, you bring it down to 200, it lowers your risk. So when you're looking at your cholesterol in general, wherever it's at, if you can lower it from that point, you're going to have a reduced risk for heart attack and stroke. So there is still relevancy to bringing your cholesterol down. Even if you have a relatively normal cholesterol, if you bring it down even lower, it still reduces your risk. Also, through healthy eating, diet, exercise, you can raise up the good cholesterol, which has been shown to be cardioprotective and help prevent heart attacks and strokes. So cholesterol is still a major player, probably one of the biggest players along with blood pressure in the prevention of cardiac and disease and stroke. It depends a little bit on your family history and health history. If you have no history of cardiac disease in your family and you can keep your cholesterol around 200 with diet and exercise and things like that, you probably don't need to be on medication, things like that. If you come into me and your dad had a heart attack at 56, your 2 brothers had them when they were 60, and your cholesterol is even 200, I'm going to start talking to you about maybe you want to bring yours down and get it a little lower because we want to reduce your risk because that genetic factor is another major piece of that puzzle that you can't change. You can't change what happened to your family. You can't change what happened to your dad or your brothers. So, but we can change what's happening to you, and so we need to try to do that. When I have someone who's been adopted or doesn't know their family history very well, tend to play it a little bit more on the aggressive side. Would counsel them to maybe treat things a little bit more aggressively just because we don't know what's going on back there. And all we need to do is take care of you right now, and so we don't know what that history is. So if you had relatively high cholesterol, not knowing what your family history is, I'm just going to assume it was bad and try to talk to you and help you into improving it. So that's typically the same with colon cancer, other cancers. It's going to maybe be a little bit more aggressive in looking at things just because you don't know what that history is. So, no, that's always been that way. Medicare, traditional Medicare, does not cover an annual physical. Many doctors would still have their patients come in and do kind of a long routine visit, but we wouldn't bill it as a physical, we just bill it as a long office visit. And we'd call it a physical, and when you came in and went out, you thought you had a physical, but we just billed it as a routine visit. Now, some of the new priority health riders, Blue Cross, Blue Shield riders, on top of Medicare, sometimes they'll cover physicals now. So if you have priority health Medicare, then you do get an annual physical as part of that. That's one of the bonuses they've kind of baked into their little plan. But if you just have traditional Medicare, You get one physical when you sign up at age 65, and then that's it. You get your welcome to Medicare physical, and then from then on, it's just office visits. So, like I said, most of us kind of still give you a pretty decent exam if we can as a routine and just bill it as a routine visit. Any other questions before we move on?